So when a woman comes in and she's overwhelmed, she's scared, she's, a host of emotions, how do you quiet that storm to make sure that she is hearing and listening, and build that trust?
Yeah.
Because if you're a new person to that person.
Absolutely. And we're both new people to each other. We have about 45 minutes to an hour to explain all of these decisions that have to be made. And it's extremely overwhelming for most women. And a lot of times I think women come in and they are the person in the family. They're the one everyone goes to. Yeah, the glue. They handle everything. They do everything. And so they're just thinking about, yes, what's happening to them, but then what is that impact going to be on the family as well? So I think where I start is you have to take care of yourself. This is the time now where your priority, because once you get through this, you can get back to your activities, your things, but breaking it down stepwise. So just making sure first that you understand what's going on with my body. What is this? What's happening?
Right.
And then a high level view of this is what we're going to be doing in terms of your trajectory of your care, because understanding where that falls in your timeline. I mean, there may be, you may have already planned a trip with the family or planned this or that or the other. So setting it out and saying, this is what we're really looking at. So this is how many months. And then once we kind of do that, I think that after that, I always try to ask, what's important to you? What matters to you? And then we're going to do our best to do whatever we can to treat this and make sure it doesn't come back.
That makes sense.
Yeah.
What are some of the most important questions that you like to see or encourage new patients to ask when they're coming in to see you? I know for Sisters Network, we have a document that's on our website under the resources. It's called What to Ask Your Doctor, from the surgeon as well as the oncologist, because there's different questions. And because we know during that time, people they're just not thinking.
Yeah.
And so we at least hope to give them a guide. But what, from your vantage point, are some important questions you would like people to think about asking?
Yeah. So I think it's important for them to ask, what does this, what are my options? And then once we kind of talk about what the trajectory of care looks like, so what the type of surgery and things like that, I think some important questions are, and it may be overwhelming in the first visit to ask about things like plastic surgery, reconstruction, and those things, but maybe who can you refer me to, or who do you think would be helpful to talk to address some of these concerns that I have at the outset? So when that happens, then it's very easy for me to say, well, I think it would be great to talk to a plastic surgeon, or I think it would be great to talk to an integrative medicine specialist who can talk to you about your diet and your exercise and things like that. So I think asking that question of after meeting with me and knowing me as a person in this time, who do you think would be beneficial for me to talk to and meet with?
For my whole care team.
Right, exactly.
Great. How do factors like age, fertility, lifestyle, and breast density play into treatment planning?
Yes. So it's basically, we have the extremes of age, and then we have kind of the middle portion. So oftentimes, I'll start with talking about kind of the older patients. So for the older patients, it depends on the biology of disease, but we want to do this good balance of treatment. We don't want to undertreat just because age is just a number. Somebody can be extremely healthy, active, maybe older, but that shouldn't preclude them from getting standard of care treatment.
Sure.
So we think about their other medical issues and things they have going on, what their lifestyle look like, who they live with at home, their functional status, and then be able to integrate an appropriate treatment plan and maybe some supportive things that they would need throughout their treatment to get them through their treatment in the first place.
Right.
For the younger patients, we typically will offer consultation to the oncofertility physicians to talk about what the implications of the treatment they're going to be receiving are in terms of their fertility and preserving eggs and things like that.
And I know time, depending on the aggressiveness of their tumor, factors into whether that's even an option. Sometimes.
Right. Sometimes we have to kind of hit the ground running, but I think it's always a good idea to meet with the appropriate people, because once you start the treatment, you don't want to look back and say, oh, I should have talked to those people in the beginning. So there's always a little lead time to meet with the appropriate people.
That's really good.
Yeah.
Are you starting to see, I know we're getting a lot of calls from young Black women, and you know the statistics for African-American women and breast cancer, so I don't need to talk about those. But for the audience, Black women under 35 are 2 times more likely to be diagnosed with breast cancer, which is very alarming. And we're getting calls. We're seeing a lot of young Black women reaching out to our organization that are 25, 30, asking, what should I do? Or just in a panic. Are you seeing that trend with, women who are coming in, particularly women of color?
Yes, I think I am. And I think generally as a group, we've kind of talked about this anecdotally, that, the research does show that there are increased numbers of younger patients, and especially in women of color. But I think also just in my patient population, in the time that I've been in practice, I've definitely seen a rise in younger.
In that. Yeah, it's just very, very concerning, especially so young.
Yes, absolutely.